And we're here in a little village called San Juan in the San Martin district of Peru. And we've brought a medical team to this village to bring medical care to a place that doesn't have access to even any kind of health post or clinic. And so we're here today to minister to people in Jesus' name through providing medical and dental care. So I want to give you a taste of what one of these medical clinics is like. And we're in a very primitive church here in San Juan where we're using for our medical clinic today. So I'm going to take you a little tour of what's going on here. First, we have the intake area or triage where Elena and Meredith are taking heights and weights, getting people registered, taking vital signs, and getting people ready to be seen by the doctors and nurses in the clinic. We also have an important part of our team is the local pastors who are here, and they are meeting people and taking advantage of this opportunity as the community comes out for medical care to be able to introduce them to the church and to the local pastor. So we have in this setting just one big room to work from, so we're flexible and make things work. In this area, we have Mark distributing reading glasses. Those are a very big help to people that don't have access to those. They're something that we can do on teams, even when we don't have an optometrist or eye doctor. We can still help them with reading glasses that will help those, especially the elderly, to be able to see, to read, or to do their work.
My sin is nailed.
Here is Dr. Natalie King attending to one of the patients. As you can see, this is not like your examination room in your doctor's office at home, but we're able to meet people and learn about their medical needs and attend to them there. Williams Reynoso is one of our Peruvian doctors that often travels with us. We always try to work with local medical people, and Williams has been gracious to come with us. He's a neurologist in Lima, Peru, and is a big help on our medical teams in Peru. So Jerson is our dentist, also from Lima, Peru. He travels with us on many of our medical and dental teams in Peru and is able to, with a fairly small portable setup, provide dental care, especially extractions for teeth that are painful, and also cleanings and other examinations that are a big help to the people that have really no access to a dentist anywhere near this village.
We were born for great.
Once the patients have finished seeing the doctor or the dentist and they need medications, we distribute those in our pharmacy. We have a fairly complete but limited number of medications that we can give for things like antibiotics, pain medicines, things like that are a big help to the people that we treat. Even if they have access to a doctor, many times they have no way to get the medications that they need. So we're able to provide both the medical assessment and the medications in our pharmacy that we bring with us. Every village that we go to, there are many children, and one of the most important strategies that we have is to minister to the children. Most children, studies show, come to Christ between the ages of 4 and 14. And so we really want to take advantage of that and minister to children. This is German, who is a brother from Venezuela that has joined our team this week to especially focus on children's ministry through games and skits and his performances as a clown, but also most importantly sharing the love of Jesus with children. We see many children come to Christ this week through German's ministry.
Just shrink when you find the one who knows.
You may be wondering, after seeing all of this, why do we travel all this way and why do we bring all these people and resources to try to reach a remote village such as San Juan here in Peru? And very simply, it's because of the love that Jesus has for us. In the Gospels, it talks about how Jesus went out to preach and to heal the sick. And we take him as a model and we integrate ministering to people in their illnesses through medical care, but also sharing the gospel with people. And so as our doctors and our team members and our dentists, everyone involved in the team takes the opportunity to pray with patients, to share the gospel with them. And in many cases, we see people coming to Christ that would never have gone to the church, but they were sick, and so they came to receive medical care and got to hear the good news that way. We also have a focus on working with our indigenous partners, our local people here. So our partner in this region, Wilkinson Grandes, works with many different pastors in these communities so that their ministry is enhanced by our presence here, and that they will be able to disciple and follow up on the people that come to Christ, and that our part is just a small piece of their ministry and bringing the gospel to this region of Peru.